Welcome back. We're with senators meeting on Capitol Hill today. David, the clock is ticking on health care reform if Congress intends to get a bill to the president's desk before the key August recess.
And Tamron, we've said before, this is crunch time right now, and all sides are using television and web ads to make their case both for and against the so-called public option that is under consideration on the Hill. In this ad, the pressure is applied squarely to Senator Blanche Lincoln, Democrat of Arkansas, who seemed reluctant this spring to support a public option. Watch.
It's a good thing Washington is finally tackling this problem.
I know. But I read in the paper that our senator's not helping. She won't commit to a quality public plan to compete with the insurance companies.
We can barely pay our bills, and Blanche Lincoln is worried about the insurance companies?
I guess she owes them more than she owes the voters.
Now, just yesterday, Blanche Lincoln came out with an op-ed in the Arkansas Democrat-Gazette, backing away a little bit, now seeming to embrace at least the idea of a public plan. So maybe the ad is working. Of course, those opposed to a public plan are also making their case.
I survived a brain tumor, but if I had relied on my government for health care, I'd be dead. Government health care isn't the answer, and it sure isn't free.
Now, Washington wants to bring Canadian-style health care to the U.S., but government should never come between your family and your doctor.
Here to make their case are Jane Hamsher, founder of FireDogLake.com, and Jillian Bandis, national political reporter for TownHall.com. Jane, it was your group that essentially put the pressure on Blanche Lambert Lincoln. You satisfied with the impact there, and where else are you targeting?
Well, I think that Blanche Lincoln has been feeling the pressure, and the ad I'm very proud of. It was directed by blogger Dave Dayen, and it was also written by a blogger, Digby. And I think that she is feeling the pressure. I'm not wholly satisfied with what she had to say. I think that she needs to firmly commit to a public plan and not the sort of weaselly Kent Conrad co-op plan that the insurance companies want, but really is just a recipe for keeping prices high and keeping the government from being able to negotiate across the board to keep health care costs low. But I think that it is having the desired effect, and we're really proud of it.
Even though your side is getting outspent 3-1. Jillian, here's the breakdown. $31 million total for 47,000 ads through the end of June. And this is, again, strictly on the health care debate. $15 million on pro-reform ads, $4 million on anti-reform ads, $12 million on ads for better care. So actually, I had my numbers wrong there. But consider this. The total amount spent on the Harry Louise ads back in 1993, $14 million. What do you make of the numbers? What do you make of the amount of money that is flowing through this argument?
Well, David, you made my point for me. I mean, it is like a David and Goliath situation out there. On one hand, you have conservatives who are concerned with patients' rights. I mean, you have groups like Patients First and Conservatives United for Patients' Rights talking about different things like rationing and cost and wait times and bureaucratic regulation of healthcare. On the other side, you have, and I mean entirely, you have Big Pharma, and they're the only people sponsoring these sorts of politically directed ads directed towards different legislators who are going up for re-election and who are, key votes in this upcoming healthcare legislation. And that just goes to show what sort of grassroots support is against the plan and what sort of big industry, public support is for it. I think that the where the ads are coming from and also the money indicates that really public support is swaying against the health plan despite the best efforts of congressional Democrats.
Jane, if there was one argument that you think voters need to take away from all these ads that you're running, what would it be?
I think that entire tone is that's crap. 76% of the American public want a public plan. And as a 16-year cancer survivor myself, I really find it offensive that people try and drag others into this and say that somehow our system that we have right now represents the 50 million people who are uninsured, or that it does anything superior for people like me, who have had to be at the mercy of bureaucrats.
I'm sorry, I'm not a cancer survivor, but that doesn't mean I can't criticize a public plan.
I suppose you are, but you don't know what you're talking about.
Oh, really? So you're aware of the wait times in Canada for life-saving treatment?
Let's take these one at a time, Jillian, one at a time. Let's take these one at a time. Jillian, what about the argument that your position does not represent? What about the 50 million who don't have health care? Who's representing their argument in this case?
David, that's a totally false figure. The 50 million uninsured, it consists of illegal immigrants and people who are already eligible for federal health care plans.
46 million, 42 million.
And then you've got
over 40 million.
Great. Okay, then you've got another 10 to 12 million who are already eligible for public plans but don't take advantage of it. You have another, I think it's 10 million people who could be otherwise eligible for the plans that Obama's are considering, but wouldn't want to do it anyway. I mean, when you break it down, I think it was somewhere between 10 and 20 million who are actually uninsured and can't get insurance. The 50 million figure is totally false.
Jane, you get the last word.
The people in this country who have to go and face bureaucrats who will not pay their bills and have to face financial ruin in order to get themselves treated is criminal. Basic health care access should be a basic human right in America. We spent $2 trillion on the banks last year.
Should
and now
food
we're
be a
talking
basic
about the
human
fact
right?
that we cannot. Do you have any pride whatsoever? Do you have any shame when you go out there and you say this stuff and when you interrupt people when they're trying to talk about their own personal experience?
Well, you're trying to accuse me of not knowing what I'm talking about because I'm not a cancer survivor.
Because we're running out of time. Jane Hamsher and Jillian Bandis, thank you both. We will be right back. You're watching MSNBC.
Kobe.